day everyone, I am a bile acid sequestrant, and for today's video, let's discuss all about myself. So let's go first for the generic name. I have three generic names, namely cholestyramine, cholestipol, and cholesivilam. When you're going to memorize it, just remember the word choles. For the brand names, I have many brand names. For cholestyramine, we have Sequestrant, Prevalite, and Locolest. For cholestipol, we have Cholestid and flavored Cholestid. Lastly, for the cholesivilam, we have Welchol. I also have chemical names. Here is my chemical name. I also have a therapeutic and pharmacologic drug classification. For therapeutic, I am a bile acid sequestrant, which means I will bind to a bile acid in order to perform my job. For pharmacologic, I am an anti-hyperlipidemic or anti-hypolipidemic. It means that I will not let the body have high or low levels of lipids. For pregnancy category, for cholestyramine, it is under pregnancy category C. For cholestipol, it is not formally assigned to a pregnancy category. And lastly, the cholesivilam is under pregnancy category B. Generally, it is acceptable because they are not systematically absorbed and therefore not felt to pose fatal risk. So now, let's discuss about my pharmacodynamics. What is my mechanism of action? How does the body respond to me? I am used for people who have hyperlipidemia or also known as high cholesterol. We all know that bile acids are synthesized by the liver through oxidation from cholesterol. Most of the bile acids are reabsorbed by the body and will go back to the liver and will synthesize in the bile again. Thus, only half a gram of the bile acids are excreted daily. My function is to bind to the bile acids in the intestinal lumen and prevent their normal reabsorption. The more excretion of bile acids in the body will result in an increased hepatic synthesis of bile acid from cholesterol, resulting to a reduction in hepatic cholesterol content. The fall in hepatic cholesterol content results in an upregulation of LDL or low-density lipolipids receptors, which then leads to an increase of the removal of LDL, an intermediate density lipolipid, cholesterol from plasma. So let's now proceed to my pharmacokinetics. How do I move through your body? Well, I am not observed in your body, but will do pharmacological actions in your GI tract, specifically in your intestines, wherein I will bind to the lipids together with the bile acids and helps excrete bile acids out of the body to decrease the amount of cholesterol in your body. I will then be excreted through feces.
Hello, I am also a bile acid sequestrant drug, and I'm going to tell you the indications, contraindications, side and adverse effects, and the nursing responsibilities in taking bile acid sequestrant drugs. For the indications, bile acid sequestrants are used in treatments for hypertriglyceridemia, primary hypercholesterolemia, and pruritus associated with partial biliary obstruction. They are also good in managing diabetes mellitus and diarrhea due to malabsorption of bile acids from the body. Contraindications. I am contraindicated to patients who are allergic to bile acid sequestrants to avoid hypersensitivity reactions. To those patients who have complete biliary obstruction and abnormal intestinal function are not advised to take me to prevent alteration of the processes in certain organs. Pregnant and lactating women are also prohibited to take me because I will give dangerous effects on the fetus or neonate inside the womb of the mother. Because I decrease the absorption of fat and fat-soluble vitamins, vitamins A, D, E, and K. Side and adverse effects. I don't have systemic side effects, for I only stay in the intestines. Thus, I do not affect other parts or organs in the body. Some side effects resulted from taking me can be seen in the GI tract, so only in the digestive system. These side effects can be constipation, diarrhea, bloating, flatulence, vomiting, heartburn, and gallstones. Now let's go to the nursing responsibilities before, during, and after taking me. So before taking me, the nurse should assess the patient for allergy to prevent hypersensitivity reactions. Check the intestinal functioning if it is okay or impaired, and if the patient is pregnant or lactating. If so, prohibit the patient from taking me. Also, the nurse should conduct a physical assessment before and during the therapy to create a baseline data and serve it as a basis if the therapy is effective or if there are adverse effects. Last thing to do before administering is to monitor the laboratory results of the patient. During therapy, the nurse should give me before meals so that I will be in the GI tract together with the food. When the patient is taking other medications aside from me, administer it an hour before or 4 to 6 hours after giving me. If the patient is dealing with constipation, arrange for a bowel program as appropriate. Offer support and encouragement to the patient for him or her to help in dealing with the drug and lifestyle changes. Conduct a teaching session to the patient about the nature of the drug to make him or her understand the purpose of the drug and to enhance his or her knowledge about drug therapy. After administration, the nurse should monitor the patient's response to the drug if it is effective or if there are adverse effects happening to the patient. Evaluate the patient about the teaching session if he or she can identify the name of the drugs and can elaborate the nature of the drug. And lastly, monitor the effectiveness of the support and comfort measures and compliance with the regimen.